Sawadee and thank you for your kind introduction today. I'm very honored to be here today, and I'm indeed very pleased to see many familiar faces today. My respect to professors, mentors, and lovely colleagues. Please show me your hand if you have an experience with this machine, air dissector and air shy. I would like to know if anyone have been using this machine at your clinic. Not a lot. So I would like to share with you the device that I have been used for about I think 7 years now without any complications or troubles. So today we are going to talk about the device that combine two systems. One is air dissector and another one is air shy injector. Okay, so for the air dissector, it uses air power to do like a subcision. So it helps to break the fibrosis or scars without causing the bleeding or actually a minimal bleeding. And with the air dissector, you can use it intradermally with 30G needle. And it helped to create the intradermal space. So after that, you can use another system, which is included in the device called air shy injector. That one is like a mesogun, but I like it better than other devices in the same level because it has a precise solution count, and it comes with the touch screen, which is very user-friendly. So if you see, you can choose the dose that you would like to inject in one shot. And then you will know how many shot counts will be. Then you can calculate the entire area that you want to use. And with this one, the tip comes with 32G needle, which is very good for intradermal injection. And what I like about it is that you can just adjust the level of the needle. I mean adjust the depth that you would like to go through. So then this is, I think it's very safe and effective because if you like to go intradermally, then you need to adjust the depth of the needle around 1 or 1.5 millimeters, not more than that. That will prevent you from complication from inject too deep that it might, some products might get into the vessel and cause you complication afterwards. So this is what I like about it. And you can use it with any kinds of solution, such as in my clinic, I'll show you the video that I use it with both non-crosslink and crosslink HA, like a filler. And also I have seen many speakers from Korea use it with UltraV, right? And many kinds of skin booster product. So it's very versatile for this device. So it works by collagen regeneration, just like by air dissection first, you do subcision, and then you can have intradermal space that you can inject the product easier and better. So this procedure is very precise because, as I showed you before, you can choose the dosage and you can adjust the depth of the needle. And this is the photo. This is the handpiece for inject the air. The air power is very strong that you can use instead of subcision without causing purpura afterward. But you need to tell the patient, like Dr. Korn said before this, that there will be definitely swelling for a few days, but usually mostly not more than a few days. And just swelling, it's worth the result with collagen stimulation. And then the smart injector. Another thing that I like about That I like about the injection is that there is no leakage at all from the system if you choose the right dose and the right depth, because with the tip, you see from the video, it has a vacuum effect. So it will vacuum the skin up and insert the needle at the right depth. So you will not lose the product. So you will make sure that your patient get all the solution or the filler. So it will not waste your patient's money. So this is video from Dr. Kwon, not mine. So at first he'll do air dissection first, like to stimulate collagen and to create a space for subsequent treatment with air injection. So it's very easy and actually not much bleeding. This is the air injection system. It comes with 9 pins of the 22G needles, and you can use with any solution. And you see it will vacuum the skin up before injection. So almost no bleeding afterwards, and you can ensure that you are in the right depth of the skin that you like to go to. ข้ามไปเลยก็ได้ค่ะ So this is quite popular in Korea that they will do in the highlight area, like the forehead and the mid cheek, to give the like whitening solution or collagen stimulation to make that area shine and glassy skin, or to minimize the pore, because the eye dissection also cause collagen regeneration. เดี๋ยวข้ามไปอีกวิดีโอหนึ่งเลยค่ะ So this is what I use with the HA filler at my clinic. So you can see the needle tip, and I can use it with the 1 cc syringe of the filler and put it intradermally. So it saves your time because there are 9 pins that goes in one treatment, and also that you know the exact depth. That is what's important, because you don't want to inject too deep. So this is the result from my patient who had the treatment done with eye dissector and air shine treatment. And this is just after 2 treatment, 3 months after the second treatment, because all of you, I think you know that for collagen stimulation and remodeling, you need like at least 1 to 3 months for the optimal result. So this one I use just eye dissector and then just peptide and like growth factors. So you see the improvement quite a lot. You can have a look at the scars like temporal area and the lower cheeks that improve a lot from collagen stimulation. And also good with the enlarged pores. You see on the right side, the nose area and the mid-cheek area that usually people will have enlarged pore. This is improvement after just 2 treatment and 2 months after. But you need to like educate your patient that they may not see like a very fast result, because you need time for collagen regeneration, like at least 1 to 3 months. And usually I tell the patient that the full effect usually after 3 months. And this is also like you see the improvement of the acne scars, and also a little bit of the lifting effect from the collagen stimulation. And so after this, they are not my patient, this is from the company. So this is when I think maybe Dr. Kwon's patient received air dissector and ultra booster. You can see the improvement of the acne scars and the pigmentation and also the wrinkles. But this is like after 10 days. It should be better after a few months. And also the pore size and the uneven skin tone and the acne scars again. So the eye dissector, you can think of it as an alternate for patients. Usually I will use it in the patient like who don't want to have the subcision done, they don't want the bruise on the skin, or they're like afraid of the risk of infection, or the patients who cannot have the laser done because they exposed to sunlight a lot. So for this treatment, usually it does not cause the photosensitivity afterwards because we don't use any heat. So less risk of post-inflammatory hyperpigmentation. Okay, this is about acne scars also, and you can use it on the stria also to promote new collagen stimulation. And also you can use it like on the necklines or on the hands or any part of the body, because it just like inject intradermally, so it's very safe and effective. And usually there is no downtime or complication afterwards. Thank you.